Joining me now, very timely, is Matt Morris. He's the Southeast Regional Director of Global Medical Response. He does a lot of work with patient access to rural health care facilities because they continue to be at risk. There's a bunch of bills before Congress right now. The problem is if you have this virus and you're not in an urban or a suburban area, well, where do you go to get tested? How do you get tested? How do you figure it out when you're in rural areas? And joining us now is Matt Morris. Matt, welcome.
Thank you, John, for having me this morning.
Okay, Matt, tell me a little bit about what you do and what you're working on now, sir.
Right. Global Medical Response is a worldwide provider of patient transport. Most of the transports that we take part in are emergent transfers from EMS providers in the field to hospitals or from hospital to hospital for a higher level of care treatment for patient conditions. We're currently working with legislature on surprise medical billing. There's some bills out there before the legislature now that discuss billing and medical billing in the type of work that we do. Rural health care is a pretty big deal in America. Most of America is rural, and most folks live greater than 20 miles from a hospital, and hospitals are in critical access at this point in time.
All right, Matt, I want to get to surprise billing, and then we're going to get to the coronavirus. So on Friday, I had former State Senator Roz Dance and former House member Chris Peace on my show, and they have worked very, very hard on getting the elimination of surprise billing legislation passed in Virginia. And so they got that done. It was not easy. You got the insurance companies, they want to gouge you, etc. That was a heavy lift. They got it done in Virginia. But where are we at the federal level? Why can't we get this passed in Congress? Denver Riggleman has got a bill. Whitman signed on. All the Republicans in Virginia have signed on to it. Warner's in favor of it. I know that. Why can't we get surprise billing federal legislation out of the House? What is going on with that?
That's a great question, John. And really not so much about surprise billing as it is about taking the patient out of the middle of the negotiation between the insurance companies and the provider of transport. It quite honestly, it's the patients that are bearing the brunt of this. And, a lot of it really has to do with surprise insurance denials, quite honestly. You and I both pay our insurance premiums, whether they come to us in our mail or they take them out of our paycheck every other week for health insurance. And then you have a catastrophic event where you have to submit for payment for services rendered, whether it be by a medical transport company like Global Medical Response or for your local emergency department. And insurance companies work every single day to try to drive that request for payment as low as it can possibly go. So, many folks in the industry argue that it's really not so much about surprise billing, even though it is, but more about surprise insurance denials from the insurance companies where we clearly pay for the service and it's just not there when we need it.
Well, listen, I'm for independent dispute resolution, and there's a number of bills in Congress that present this, but isn't it amazing, Matt Morris, that we got it done at the state level in Virginia, but it's bottled up on some committee in the House, right? Why can't they just take the example that we just did here in my state and get that done? I don't understand what the holdup is.
Right. Yeah. I think it really comes out to segmentation, right? Is it the billing issue? Is it the insurance issue? Is it about taking the patients out of the middle? I think that once we really segment it out and kind of silo it off and really sort out the priorities, my opinion is that until we get that done, we'll really struggle with getting the bill passed at the federal level.
Well, here's the bottom line, okay? The number of K Street lobbyists for insurance companies running around the Capitol, right? I mean, that's really what the issue is, Matt, when you get right down to it, right? They've got more money. In Virginia, we were able to overcome that. I mean, you walk the halls of Congress right now, you got every insurance company has major $100 million lobbying firms on K Street throwing money around there, and that's how they get this stuff bottled up, because the insurance companies don't want this because they make a windfall because they don't pay it, right? And so we have to pay it. And so that's what the issue is. Am I right, Matt?
Yeah, John, absolutely correct. And unfortunately, the patients out there are suffering. The insurance companies are trying to decide whether or not your transport is medically necessary or not. And what I would argue is that if my child is being transported from one hospital to another for a treatment or care that's not offered, I would much rather the doctor make that decision than the insurance company make the decision. So we've got to get the patients where they need to be so the correct decision is being made.
Absolutely. You're spot on with that. We're with Matt Morris, Southeast Regional Director, Global Medical Response. Let's go to rural hospitals. Now, you mentioned that the majority of people live over 20 minutes away in the United States to any hospital. Tell us what your involvement is and how that is solved, especially with the coronavirus. If you live at 2 hours away from a hospital, how do you even get a test?
Right. Well, John, certainly the coronavirus is stressing all of the healthcare system, not just the transport paradigm that we're associated with, but local emergency departments, freestanding ERs, urgent cares. Folks are showing up with flu-like symptoms, and testing has become a little bit of an issue. But the rural access hospitals in this country are truly in a crisis because of funding. A lot of them are closing, and when your local hospital closes, all of a sudden you were 15 miles from the local ER to take care of your bump in the night. Now you're 55 miles from the local ER. It truly becomes an issue, and when you start talking about the life-threatening emergency conditions where you need to seek treatment, it becomes a real issue. And so that's where we concentrate a lot of our focus in the rural and super rural areas across the country to try to close that gap.
So if I live in an area and I'm 2 hours or an hour from a hospital, right? What would be your suggestion? And I have the symptoms of coronavirus, Matt Morris. What would be your recommendation? What do I do?
Yeah, there's a lot of guidance out there right now from the CDC and from the local state municipalities, health departments about contacting your local private healthcare provider and following some direction from there. They've got some criteria out there that discuss your symptoms and screening mechanisms and whether or not you need a test or don't need a test. Because the fact of the matter is there's some folks out there that don't need a coronavirus test, but there's some folks that will. And so you've really got to contact your private healthcare provider to kind of be screened for that correct criteria.
So call your doctor and go from there, basically. But, one of the things that the president said yesterday is they want to make testing available. But one of the misnomers out there, Matt, is you don't have to get tested unless you have the symptoms, right? I mean, if you just have what you think is the normal flu without some of the respiratory issues that comes with this COVID-19, I mean, is there really a reason to go spend the money to have a test?
Right. Well, and that's really the basis of the criteria before you actually get into the testing phase. It essentially is a box checkoff list, and if you've got cold flu-like symptoms, if you've traveled abroad in the last 14 days, if you've got X, Y, and Z, then you enter the pipeline for the testing. But the criteria on the front end of that is what is most important to decide whether you are or you are not a candidate for testing.
I know, right? All right, we're with Matt Morris, Southeast Regional Director, Global Medical Response. Matt, I want to get back to this surprise billing. I'm very frustrated we can't get a bill out of Congress. I've been covering this forever. I was caught in that thing. Insurance companies screwing everybody. I want an independent dispute resolution. We can't seem to get it done. The other thing is, you're in this business, right? You're in this business. Why is this happening to begin with? Like, how can this even... You go to the doctor, you go to a hospital, you get treatment, and nobody goes to you and says it's in or out of network, right? You're getting something, getting an operation or something goes down. I mean, how is this even legal?
Yeah, John, I can't really speak to the legality of it, but the insurance companies are just really, at the end of the day, if they would just do what we essentially hire them to do, what you and I hire them to do, what we pay for them to do, essentially cover our claim for which we pay the premiums for every single paycheck. Every time they send a bill in the mail, we're scratching off that check. And then we, have to repair the bumper on our car, or God forbid, have to be transported to a hospital in another part of the state for specialized care. and then we ask for them to pay the appropriate amount. They just try their best to drive that down just as low as it can possibly go until the hospital, the transport company, or your local physician just is at a loss. He says, I can't accept the payment for the services, and so many companies are bound to send the patient a bill at that point. And so the patients are truly caught in the middle of this, and the insurance companies are really the root cause.
Right. At the federal level, how could they learn from the great experience we had in combating this in Virginia? What would be your recommendation for that, Matt?
Well, I think, first of all, we've got to get folks to the table, and we've got to understand it from everybody's perspective. And I think that, again, I think that we need to talk about it in segments and understand what's important to everybody, and have some type of roundtable conversation and get it figured out. But most importantly, understand that the patients, who are probably, quite honestly, having the worst day of their life when they need the insurance company to cover the benefit, need to be taken out of the middle of the conversation.
Yeah, because I shouldn't be, if you're paying your insurance premiums, you really shouldn't be then negotiating with your hospital or your provider on the phone, trying to negotiate a bill that you had nothing to do with. That's why you have the insurance. I mean, it's insane right. The way this is set up. And again, man, it's just, you go to Washington like I do every week, and you go to Congress, and the lobbyists that pull up there in their Mercedes-Benzes and their BMWs, and they walk around in $10,000 Baroni suits and Rolex watches, throwing the money around. I mean, that is really what is wrong with D.C. And you get a simple thing like surprise billing, right? What congressperson in the House of Representatives, representing constituents across America, what congressperson, either party, this is not even ideologically driven, right? What congressperson in the House today would say, you know what, screw the patients, surprise billing, hey, too bad, pay it. Nobody's going to say that, right? Nobody's going to go back to their district on the week that we have off coming up and say, hey, I killed any effort to get rid of surprise billing because, hey, I'm taking a lot of money from these insurance companies, and too bad, if you get a surprise bill, don't call me. Who's going to say that, Matt? Nobody. But yet it's just sits there.
Yeah, I believe those folks would be few. Yeah, they would be few and far between for sure.
There'd be zero. But yet it sits there. And so they play politics with it. They got the insurance lobbyist. Then they try to tag everything else on it with all their other things they want. I just want a clean bill. I want a clean surprise billing bill. I want it to get out of committee. It'll pass the House overwhelmingly. It'll pass the Senate overwhelmingly. The president will sign it. I mean, this should have happened weeks and weeks and weeks ago, but you got the lobbyist, and then you've got, well, here's a good thing, and then I want to tie my cracker package to it, my goodie bag to it, so that I can get all this other stuff I want. And then you have a fight, and then it sits there on some committee. Ridiculous. Matt Morris, thank you for being with us.